Hi, my name is Dr. Todd Gothelf. I'm an orthopedic surgeon with special interest in foot, ankle, and shoulder surgery. This means that I do surgery on the feet, ankle, and shoulder problems. I first became interested in orthopedic surgery while I was in medical school. I enjoyed doing lots of sports and enjoyed the aspects of orthopedics that involved in getting people back into their sports and into their activities by treating all their musculoskeletal conditions. With regards to independent medical examinations, I see people across a range of different injuries involving personal liability, workers' compensation, and motor accident injuries. I deal with clients from a range of different industries, including anywhere from airport workers, miners from the coal mining industry, and in the healthcare profession. When I see a client, I try my best to make the encounter a pleasant experience. I want the client to understand what their problems are. I want to make sure that they are listened to, that I acknowledge their problems they're having, and that I help them as much I can understand all the aspects around their injury and how they can return to their full activity and function in life. When dealing with clients and referrers, my goal is to help them understand aspects that are important around these injuries, especially specific to causation, work capacity, and advice on treatment. When I see a client, I try to make sure that they have a positive experience, that they leave there with some extra knowledge of understanding about their injury and how they're going to deal with it in life. I would like to make sure that they're dealt with respect and dignity, and that when they leave there, they felt like they got something out of the experience. What I hope to achieve by providing expert medical advice is to bridge the gap between medical knowledge and science and those people involved in the injury world. I like to try to educate as much as possible to help people understand the difficulties and complicated matters around everyone's injuries and help people get back to return to work as quickly as possible and as safely as possible. As an independent medical examiner, my duty is to the court and to try to be as objective as possible in giving a decision. In that same instance, when seeing patients or in seeing clients, I try to help them understand their problems as much as possible, to leave them with a positive experience and help them in any way I can. What I hope to achieve by providing an expert medical opinion is to bridge the gap between the medical world with science and information and the injury world and those involved in helping clients restore their function and get back to work. I do this by trying to educate my referrers about the problem at hand, the diagnosis, causation, dealing with aspects of work capacity, getting people back to work as early as possible, and also treatment advice. One of the most important aspects of giving expert medical advice is you and helping you understand the problems at hand. Therefore, whenever I'm referred a client, I always try to make myself available for any questions or phone calls to discuss matters and ultimately to help clients in whatever problems they have.